Hi, I'm Dr. Nafisa Sekandari, a licensed clinical psychologist specializing in anxiety-based disorders. Not wanting to take medication as an excuse to not get help for mental illness is a poor excuse. Mental illness should not be synonymous with medication. There are so many treatment options available today that for many, medication doesn't even have to be an option if they don't want it to be. With so many treatment options available, there really is no reason to suffer needlessly. I've been treating mental illness for over 10 years now and have never had to refer my patients out for medication. That's because I use a variety of treatment options to treat mental illness, and my focus is holistic and integrative. I want to stress the fact that I'm not opposed to medication for mental illness, but I am opposed to medication being the first and only thing you turn to for help with mental illness. Also, medication isn't always the only answer. I really started steering away from prescription medication as an option to treatment after hearing so many of my patients talk about the side effects associated with certain psychotropic medications. Many complain about the way certain medications made them feel and the long-term dependency some medications tended to create. Also, many didn't want to be on medication for the rest of their lives, but their doctors told them they'll need medication forever. That can be an overwhelming thought. I know I don't want to do anything forever, including taking medication. Because I've always chosen the alternative path to treating medical issues for me and my family, I've spent a lot of time learning about alternative medicine. What I've found is there are so many ways to treat a problem, really any problem, but also medical and mental health issues. Prescription medication is just one of those ways. My goal for my patients is to empower them to learn about as many ways as possible so they can make the decisions about what works best for them. Feeling empowered makes focusing on treating mental illness manageable and simple. We normally don't take action because we don't know what to do or how to do it. This is called analysis paralysis. Having a simple routine to fall back on makes it easier to get started. This is where I come in. By simplifying treatment for my patients and students, they're more motivated to make their mental health a priority. I'm also a big believer in providing many options to my patients so they don't feel limited by the choices given to them. My treatment goes way beyond talk therapy to empower my patients and students in the variety of ways they can help themselves, so they don't become dependent on me either. I don't want anyone in therapy for the rest of their lives any more than I want people taking medication for the rest of their lives. If I do my job right, I take the patients coming to see me or taking my courses to get all the tools they need to go forward in life in feeling more empowered and in control of their lives. I see myself as a guide that guides my patients and students back on track to feeling healthy, happy, and empowered. If you want to start feeling better and get back on track, you can start by joining my 21-day guided meditation challenge. For 21 days, you'll get a different type of meditation or exercise to try so that you can find the strategy that works best for you. In this challenge, I show you a variety of options from guided meditations, affirmations, tapping, qigong, and breathing exercises. I'll post a link in the description. If you're enjoying the Mental Health Break podcast, please don't forget to subscribe so you'll always know when there's a new episode. If you're listening on Apple Podcast, be sure to give us a review or 5-star rating since that'll help others find the podcast. I can't wait to see you here next week. Same time, same place. Bye for now.